Let's speak now to Sarah Kline and Roy Dahil from the Philippines. Thank you both for being here with us on the programme. Let me ask you, first of all, to Roy, just paint a picture of mental health there in the Philippines.
Yeah, thank you so much for the question. So in the Philippines, especially during the pandemic, there's been also an increase in the cases of depression, especially among the youth. There has been a study released that there's a 97.2% increase in cases of depression, and the healthcare providers are not able to cope up with this surge in the increase, primarily due to the pandemic and because of the isolation and the different effects of pandemic. And like right now, it is important in different countries to explore different options for us to provide services and different promotion strategies.
Sarah, you're running this conference. Is that sort of description typical of the sorts of services being offered in so many parts of the world?
Yes, unfortunately, it is typical. What we're seeing is in many parts of the world, there's been an uptick in the number of people needing support, but their services just aren't there. There's either a lack of funding in many cases, but also a lack of mental health personnel. And so what we're seeing are people turning to each other for support, particularly young people turning to other young people for support.
And can you gauge whether the amount of people affected is growing? I referenced there the pandemic. Are you getting a sense that actually the problem was there before but exacerbated now?
Yes, I think what happened during the pandemic is obviously we had many more people feeling very lonely and isolated. There was also a huge pressure on young people who were trying to study for their exams. Many mental health conditions, in fact, 50% begin before the age of 14 and 75% before the age of 24. So there's still a lot of ignorance and misunderstanding, and people don't realize that children and young people really suffer from their mental health. And talking to colleagues, for example, from Bangladesh, the pressure even on young children at school is such that they are also taking their own lives due to that pressure. So COVID-19 was a big factor, but going forward, there are other pressures in young people's lives.
Roy, let me bring you back in. Give me a sense of what public attitudes from politicians are like around mental health issues. Are they taken as seriously as you would like to see by both the public and those people who are in positions of power?
Right. So I can also share in the Philippines, so a lot of people are also seeking professional help, especially exacerbated during the pandemic. In terms of the political landscape, fortunately for the Philippines, a lot of government leaders and also health advocates are also talking about it. But we believe that it's not being talked about as much, or it's not being talked about enough. So there's really important to have a sustained and continued conversation about it in order for the government to always continue and not really forget the importance of mental health, especially during this pandemic.
And briefly, what sort of help are you able to give, especially young people?
Yeah, so currently our organization are focusing on stigma reduction and improving the access to mental health services through the use of different digital technologies. So like currently we are developing a mobile applications in order to increase the access to different promotion and prevention materials for people, and especially the young population in the Philippines, to be able to take care of their mental health.
Sarah, just a final word, Sarah, to you in terms of a route map to improving the situation in so many of these countries. How confident are you of making real progress?
Oh, I'm very confident we can make real progress. We have people here from around 46 countries, and the Global Mental Health Action Network has members from 130 countries, 3,000 of them. We've heard from partners already today from Ghana, from Nigeria, from Pakistan, Indonesia. They've made real change happen. They've made suicide no longer a crime. They've updated legislation. They've started arguing for better rights for people with mental health conditions. Change is really happening, and I'm very confident we can do more.
Well, it's a really important conference that's going on. Thanks for both of you for joining us here on BBC News to discuss some of those issues. Thanks so much.